All right, so Evan, what we're doing, we're not able to stream on Facebook Live. We are just going to do our best. We're going to do the Zoom. We're going to record the Zoom and post it later. Okay, so thanks everyone. Congressman and Senator, thank you for being so patient. So are we recording now, Amelia? Okay, thank you so much. My name is Delegate Robbyn Lewis. Thank you so much for joining us today. You have landed on the public forum that's entitled "The Cancellation of Hopkins Medicare Advantage Plans: What You Can Do." We had hoped to stream this on Facebook Live. Thanks for being patient with us. We'll post this later. I also want to mention that this should be closed captioned so that we ensure a broad accessibility so that as many members of the public as possible can access this information. At least we're going to try. This forum is being recorded on Zoom after the meeting has ended. We will ensure that the recording is made and all of the materials, links, references, and guidance will be made available as broadly as possible to the public. I'm so proud to be joined here by my co-hosts, Congressman John Sarbanes and State Senator Cory McCray. Very grateful to you both for making time and really grateful for your leadership and assistance helping the people of our city and state, especially in times of need like we're in today. Please note that Congressman Kwesi Mfume wanted to join us in person. His schedule didn't allow him to do so, but he's represented here today by Mr. Anthony Jones, who is the district director for Congressman Mfume. I'll provide a quick overview of tonight's agenda so that you know what we're going to cover. And once I've done that quick overview, I'll hand the mic to my esteemed co-hosts. Amelia, can you take us to the slide? So our agenda tonight, the purpose of tonight's meeting is to provide information to the public. This came about because numerous Baltimore City residents contacted myself, Congressman Sarbanes, Senator McCray, Congressman Mfume, all of the elected officials representing Baltimore City to ask for help. They received a cancellation notice about their Medicare Advantage plans issued by Johns Hopkins Medical Systems and wanted to know what to do. So this forum came about because our constituents asked us all for help. The Medicare Advantage health insurance plans specifically were those issued by Hopkins Health Advantage. So the purpose of this forum is to provide information guidance to those Baltimore residents affected by the cancellation of the Hopkins Advantage plan. We have received questions in advance from the public. Thank you to everyone who submitted questions. We will do our best to answer those questions today. Next, I'd like to introduce Congressman John Sarbanes. Congressman Sarbanes represents the 3rd Congressional District, and that includes a chunk of Baltimore City. He has been in the US Congress since 2007 and serves as the vice chair on the House Subcommittee on Health. So he spends a lot of his time working on issues related to health insurance, healthcare access, and we're grateful to him for being here. Congressman Sarbanes, will you please take the mic?
Thanks very much, Delegate Lewis. I appreciate the opportunity to join with you tonight and offer a few opening remarks here at the beginning of this very important information session. I want to thank you for your emphasis always on constituent service. That's what this evening is all about, making sure that you're reaching out, communicating with people in your district. And obviously there's overlap with the 3rd District of Maryland as well. And we have Senator McCray here because of his constituent outreach as well. This is what it's all about, making sure our constituents feel that they're being respected, that they're getting good information and that there's strong communication channels in place. Obviously, the particular focus this evening is to provide information to those enrollees in the Maryland, the Advantage Maryland plan, whose participation has been discontinued and need now to understand exactly what their options are going forward, make sure that that information is available to them. It's very important, obviously, that we continue to maintain a robust and strong Medicare program throughout the country, and certainly in Maryland and in Baltimore City, make sure that Medicare is there for people. And tonight you've assembled experts, I appreciate that very much, who can give people insight into how that support is there going forward, and some assistance with making those important decisions. At the national level, I will just say, well, I've got a couple of minutes of people's time. We continue to work hard to keep the Medicare program strong and to improve it with things like allowing the program to negotiate more forcefully on the price of prescription drugs. That's something that's been included in the Build Back Better plan, which is now being deliberated on Capitol Hill. We're very hopeful that we can make strides there, because we know that the cost of prescription drugs is too high, not just for Medicare enrollees around the country, but for everybody, really. So taking steps there is an important thing that we can do. In addition, we're trying to limit the out-of-pocket expenses under the Medicare Part D program to $2,000 per individual on an annual basis, which would be a huge step forward, because currently the average out-of-pocket expense for our seniors under Part D is about $3,200. So if we can put that savings in place for Medicare enrollees, it'll make a huge difference. Those are just some of the things that we're trying to achieve with the Build Back Better plan. But again, I want to come back and thank you, Delegate Lewis, for listening carefully to your constituents, making sure that when things happen that cause some disruption and invite questions on their part about how to move forward, that you're offering the kind of services and insight and resources that can help with that decision. So thank you very much for doing that on behalf of your constituents, but certainly doing it as well on behalf of my constituents that I represent. With that, I'll hand it back to you.
Thank you so much, Congressman, and really appreciate the hard work you're doing on our behalf in the U.S. Congress. And thanks for just being there. And we just wish you good luck and health and safety. Next, we'll go to our representative from Johns Hopkins Health System, Nikki McCann, who's the Vice President of Provider Payer Transformation. Ms. McCann.
Thank you. Thank you so much. On behalf of Johns Hopkins Advantage MD and Johns Hopkins Medicine, I want to first thank Delegate Lewis for conducting this important forum and for inviting us to join tonight. I also want to thank all of you for joining and lending your expertise and concern. Organizing an event like this certainly shows a sincere concern for the well-being of Baltimore City residents and a commitment to support them. Please know that at Johns Hopkins Medicine, we share this concern and commitment. Unfortunately, we're all here today because our plans to grow our Johns Hopkins Advantage MD program did not materialize in the way we had hoped when we started the plan in 2016. We were forced to make some difficult decisions to keep the program operating by reducing our service area from 12 of Maryland's 24 jurisdictions down to 10. The ability to offer Medicare Advantage in Maryland is challenging. It's challenging because of the state's unique Medicare payment model, which results in lower reimbursements that have caused some other Medicare Advantage plans to leave the state altogether. We've been working with our state and federal partners, and we are hopeful that we will be able to find a fix for the future. But unfortunately, we were not able to do so this year. This decision was not made lightly, and we sincerely regret that it has created stress or uncertainty for any of our members. Many of you have asked why this decision was made, and I will tell you the answer. Like most things in healthcare, is complicated, but I'll try to give a simple answer. And as I just mentioned, there is a challenge with how Medicare Advantage plans are reimbursed in Maryland. The result is that there is a small and struggling Medicare Advantage market here in Maryland. Throughout the country, about 40% of Medicare members have Medicare Advantage, but here in Maryland, that number is about just 14%. Healthcare plans are required to be financially stable and sustainable. Every year, Advantage MD, like every plan, evaluates all of our products to ensure that we can continue to meet the healthcare needs of our members with the highest standards of quality. Advantage MD had to reduce its service area in order to meet sustainability goals. Baltimore City and Calvert County were selected for service area reduction because those jurisdictions had the highest cost. As we continue to advocate with our state and federal partners, we aim to ensure that all Marylanders have access to quality Medicare Advantage plans. Now, along with Delegate Lewis, our top priority is ensuring that you all have the information and assistance you need to make the best decisions for your healthcare needs moving forward. We know that finding the right health plan is highly personal and know that some coverage options will be better for some and not for others. Delegate Lewis has convened a panel of experts who can help give the guidance and advice to ensure that people select the plan that is right for them. Additionally, Johns Hopkins has a dedicated hotline. That number is 844-820-1227. Again, that's 844-820-1227. Our customer service representatives will take time to go over coverage options with you in detail and offer guidance on taking next steps. We've also shared numerous communications with our providers and members regarding next steps and will ensure that Delegate Lewis has copies of all of those communications as well as all the elected officials attending today. Again, I want to thank Delegate Lewis, Senator McCray, Congressman Sarbanes for hosting this forum and for inviting us to participate in this crucial discussion. I want to thank all of you for attending and listening. It is our hope and intention that any disruption to your healthcare needs is minimal. We have heard from so many of you that you like your Medicare Advantage plan. Johns Hopkins will continue to advocate for a fix to the Medicare Advantage challenges of Maryland with the hope that in the future, every Marylander has adequate Medicare coverage options. Again, thank you, Delegate Lewis. Appreciate the opportunity to speak, and I'll hand it back over to you.
Thank you very much, Ms. McCann. I really appreciate Hopkins being here to make a statement and help folks understand the decisions. Next, I'd like to hand the mic over to Senator Cory McCray.
Thank you, Delegate Lewis. And just want to first start by saying thank you for your leadership for putting this together. I know that it's very time consuming, but it's equally as important. I'd also like to thank my colleague, Congressman Sarbanes, Congressman Infume's office, for the opportunity to just stand in solidarity and make sure that we're moving forward in reference to the Medicare Advantage program. I tell you all that I was very disheartened when I got the emails, the 5,000 folks that are affected by this, specifically in the Baltimore City community in which I represent, Northeast and East Baltimore. And the emails that was coming in was very challenging to look at. They were very disheartening because I think that when you give 30 or 40 years of your life to any occupation, that we should make sure that we stand by our seniors. And that's just what we will be doing with that Medicare Advantage program. I just want to let folks know that not only have we been in contact with Hopkins, not only have we been in contact with our federal partners, but we've also been in contact with our Department of Health. We've been in contact with our HSCRC, the Health Service Cost Review Commission, to make sure that they know the importance of this and understanding like how are we going to move forward as state partners. While this is primarily a federal issue, we have to leverage every tool in the toolbox to make sure that our waiver system, that our Medicare Advantage system is conducive for all of our constituents, not just some constituents, but all of our constituents, especially within the city of Baltimore. I want to be clear that once again, when I got this news from my constituents, it was very challenging. I think about the healthcare, the Hopkins Healthcare Advantage, Medicare Advantage program, and that's like a Cadillac program. So you get the wraparound services that are necessary, and folks were very much enjoying that service. We know that many of the Medicare Advantage programs aren't on that level. So when they specifically said that they were removing Baltimore City, it was very disheartening knowing the number of the challenges that we have in our city, and this compounded on that issue. I think that it also was very concerning in reference to just competitiveness, knowing that you can go across the line and have a different Medicare Advantage program or that Cadillac plan in Howard, Baltimore, or other adjacent jurisdictions. That was very concerning. As stated, about the 30, 40 years of any occupation, we have vulnerable communities. And I look at those vulnerable communities as our young people, the disabled community, and most importantly, our seniors, as stated, that gave 30 or 40 years of their life to their occupation. And then I think about the level of communication. I think that communication is very important. I do not like surprises, but unfortunately I was surprised by this information, but was glad when I was able to learn and dig deep into what was happening here. I once again want to thank Delegate Lewis, because while we can dwell on the issues that we have in front of us, the most important thing that we can do is figure out how we're going to move forward. I thank the panelists, because I believe that Nikki gave the number in reference to how Hopkins is making sure that those folks, December 31st, that may not even, not that they're not aware, but making sure that they're not taking it primarily as a serious issue that we can get in front of this. Folks, I tell you that these are not just our family members, they're our neighbors, they're our friends, and we have to make sure that those 5,000 that are affected, especially in the city of Baltimore, understand what's in front of them and how to move forward. I think that we also have to make sure that we do not take our foot off the gas. A lot of times when emergency situations happen, most of the times we think about it when a fire is happening. But this is going to be one of the longstanding issues. So I say stay in contact with Delegate Lewis, stay in contact with myself, stay in contact with Congressman Sarbanes, stay in contact with Congressman Mfume, Senator Cardin, Senator Van Hollen, because this is a very, very, very important issue that will be negotiated and will be discussed going forward. I cannot say it enough, Delegate Lewis. I put these on. I know how much work goes into it. I know how much staff time goes on into it. But like I said, I also know the importance. To the panelists, you could be somewhere else at this moment, but you're here with us today, making sure that our seniors in Baltimore City and Calvert County understand how to proceed forward. So I say thank you. At this time, I'm going to pass the mic back off to my friend, Delegate Lewis. I can't say it enough, but thank you, thank you, thank you.
Senator McCray, thank you for making time to be here. Just so everybody knows, we just got out of the House chamber and the Senate chamber. We were voting in special session today, and really appreciate you rushing over and making time. I understand you have to go. Please feel free to jump if you must. Thank you, Senator McCray. And we do work together closely. We'll keep doing that. Next, we're going to move into the presentation segment of this public forum. And if it's okay, I'd like to take the screen and show you once more the agenda and what we'll be going through. Amelia, if you'd be so kind to flash that agenda on the screen. Thank you so much. We got a lot of slides. There we go. So we've had the introduction, we've had the remarks. Now we're moving into presentations. First, we're going to have a presentation from the Maryland Insurance Administration. They will talk about the big picture setting for Medicare Advantage. They'll also talk about the resources and information that they have available. The Maryland Insurance Administration is a fantastic resource for all of us. Next, we'll have a presentation by the Baltimore City State Health Insurance Assistance Program. Their acronym or nickname is SHIP. And what they'll talk about is the Baltimore City level picture around Medicare Advantage, and they'll describe the services, programs, and guidance that they offer. So another great resource for all of us. Finally, we're lucky to have two private insurance brokers who will talk about the services they offer, how they can assist Baltimore City residents who are seeking new plans. So we'll have the state and city resources to help you choose new plans. But we also want to make sure that you're aware of private resources that you can seek. So we'll have those. At the end, we'll tackle the question and answers that we have received from the public. We'll do our best to answer those questions in the time that we have. And then we'll close. So with no further ado, I'd like to hand the mic over to our representatives from the Maryland Insurance Administration. And that is Joy Hatchett, who's the Associate Commissioner for Consumer Education and Advocacy. You know what? Forgive me. Ms. Hatchett is present, but she'll not be presenting. Our presenter will be Ms. Patricia Dorn. Ms. Dorn is the lead outreach staffer in the Consumer Education and Advocacy Unit. Ms. Dorn, over to you.
Thank you, Delegate Lewis. My name is Patricia Dorn, and thank you for letting us speak today. I'm here from the Maryland Insurance Administration. What I'm going to be presenting is the Medicare supplement, an alternative to Medicare Advantage. This isn't us saying one is better than the other. This is just us presenting all the information. So the beneficiaries that are affected by this have all the information to make the decision that best works for them. My email address is at the bottom here. Next slide, please. So the Maryland Insurance Administration, we're the Maryland state agency that regulates the business of insurance in Maryland. While we do regulate the Medicare supplement product, that's going to be the product that I'm talking about the most today, we do not regulate Medicare Parts A, B, and D, and we also do not regulate the Medicare Advantage plans. Next slide. So my Medicare Advantage plan contract with Medicare isn't being renewed. What happens? So that's what's happening, unfortunately, in this situation. And so a beneficiary in a situation can join another Medicare Advantage plan, or they can purchase a Medicare supplement policy and a Medicare prescription drug plan. When? So for the Medicare supplement policies, the beneficiaries, as soon as they receive the letter saying that the plan was ending on 12/31, they would have been allowed to start to purchase the Medicare supplement policies. And then that continues on for 63 days past December 31st. So they have a guarantee issue period that lasts for 63 days beyond December 31st. For the Medicare Advantage plans, some of the beneficiaries may have chosen to sign up during the regular period of open enrollment between October 15th and December 7th. However, they also have from December 8th until the last day of February. So from December 8th now until the last day of February to choose another Medicare Advantage plan. However, beneficiaries, if you wait until after January 1st to choose your plan, and you have until the last day of February, just know that from January 1st going forward, until you find something else, you won't have that approximately 20% covered. Your old plan will no longer be in effect. Next slide, please. This is a list of the Medicare Advantage in Baltimore City. So this is a list of the other plans that are available, as well as the phone numbers that are available. This information would also be available from SHIP and the next speaker. And as well, this information is going to be available on medicare.gov. Next slide. So I'm going to talk to you about the Medicare supplement. So the Medicare Advantage plans, those are the plans on the previous page, are the other Medicare Advantage plans that you can now join in Baltimore City if you are losing this plan. Again, though, we're going to talk about the Medicare supplement, which is another option for you. You have a guarantee issue right into the Medicare supplement for 63 days past January 1st. And that's important because with the Medicare supplement in general, you only have the first 6 months after you started on Medicare. So you only had 6 months to purchase a plan without being medically underwritten. So without them asking health questions, charging you based on health, or possibly denying you. So you only had 6 months, but in a situation like this where you're losing a plan, you have the 63-day guarantee issue where they will not medically underwrite you. You will get the best price for the plan that you're interested in. Next slide, please. So this is just to help you understand the Medicare supplement. If as a beneficiary of the Johns Hopkins plan, you want to look into something else. So the Medicare supplement is a product to supplement original Medicare. What that means in like layman's speak is it supplements parts A and B. So it works like the Advantage plan paid for those additional costs that A and B doesn't cover. The Medicare supplement is doing that as well. It pays for cost sharing for A and B. So deductibles, co-pays, co-insurance, but not D. So with most of the Advantage plans that are offered in Maryland, D as in drug is included. If you just purchase the Medicare supplement plans, you purchase a separate standalone Part D plan. These are going to be purchased from private insurance companies, and there are 12 standard plans in Maryland. Next slide, please. This is the cover of our rate guide. If this is something that you're interested in, or if you just want more information, you can find this rate guide on our website, insurance.maryland.gov, or you can contact us, you can call us, and we're happy to snail mail out a copy to anyone who is interested. We update the rates in this guide twice a year. Next slide. This is what the inside's going to look like. There isn't any information about an insurance company here. We're the regulator, but this is a snapshot of one page of what's in the rate guide. And what it's going to show the Medicare beneficiaries is which letters of the Medicare supplement are available to them from those companies, and then what the rates are for different ages. It's in 5-year increments from 65 to 85 here. And then also we show the rates for the under 65s. So for the most part, those are people who've transitioned onto Medicare from Social Security disability, and those rates are in the guide as well. What's shown is monthly rates. Next slide, please. So this is just to reemphasize. Do the Medicare supplement plans cover prescription drugs? Some of the older ones did. For the most part, you have to purchase a standalone D if you want prescription drug coverage. Obviously, under A and B, sometimes if you're hospitalized or in certain situations, drugs are covered. But for the most part, you have to purchase a standalone D, and that's how you're going to get your medication coverage. Next slide. Okay, so Part D, that's the medication coverage. And I feel like I have to reemphasize this a little bit because a beneficiary who has had a Medicare Advantage plan, isn't necessarily accustomed to purchasing this separate product. So Part D is medication coverage. Different plans have different costs and formularies. So anyone who is purchasing a Part D plan, you do need to carefully make sure that this plan is the best one for you. On Medicare.gov, you can put in your information, including the drugs that you take and the dosages, and then it will order the plans from least expensive to most expensive. And I might not have made it clear before, but that period from up until the last day of February for folks with the Medicare Advantage plans to sign up for a new Medicare Advantage plan, that is also for Medicare Part D as well. Next slide. So this is my email. I do encourage you, if you have questions, to send me an email and I will answer it as quickly as I can. Thanks so much for giving me the opportunity to speak, Delegate Lewis.
Thank you so much, Ms. Dorn. That was really a seminar on Medicare, Medicare Advantage, Medicare supplemental plans. Great information. I want to reassure everyone that the list of Medicare Advantage plans available for Baltimore City residents that was offered in this slide set, that will be shared and made easily publicly available on my Facebook and Twitter, and we'll email it. We'll make sure you get it. One-stop shop for that information. And thank you also for the briefing on how Medicare supplemental plans and private Part D plans work. Really appreciate you. Next on our agenda, we'll have a presentation by 2 private insurance brokers who will explain, am I right? No, I'm wrong. Next, we'll have Pamela Massey from the Baltimore City State Health Insurance Assistance Program, the SHIP program, to talk to us about hone in on the city level. Thank you. Ms. Massey, please go ahead.
Hi, good evening, and thank you also, Delegate Lewis, for inviting Baltimore City SHIP to speak at this public forum. So I guess I will start by saying I'm going to piggyback off of Patricia Dorn, and thank you, Patricia, for presenting what you have presented, because I guess I will say that the SHIP program, let's say we provide the action part of what Ms. Dorn just presented. So again, we are the State Health Insurance Assistance Program. I am the program manager for Baltimore City. We're under the Baltimore City Health Department, Division of Aging and Care Services. So with SHIP, we conduct the Medicare open enrollment from October 15th through December 7th. We are aware of what has happened with Baltimore City Medicaid beneficiaries. So we're also keeping our lines open to continue to help with providing the information that the Baltimore City beneficiaries need to make their decisions. What we do is, compare plans. We look at different plans with the beneficiaries so they can make their informed decision. We're open year round. We provide one-on-one counseling over the phone, especially since the pandemic has hit. SHIP services are all free. We do outreach in communities, presentations, and our goal is to provide Medicare beneficiaries and their families and caregivers the information to make informed decisions regarding their health care plans. We screen for the eligibility, and also we do partial completion of applications when it comes to QMB, SlimB, Extra Help, and SPDAP. And we do that because trying to make it more convenient to encourage a person to complete that application and submit it. And what happens is we mail it out to whoever the person we've worked with. So all they need to do is attach their proof of their income and things like that. So we're really trying to make it very convenient for seniors. And, because it can be difficult with the writing and different things like that. Also we do help with fraud and abuse cases, Medicare appeals. So our office is, like I said, like the action part for the Medicare beneficiaries. And you can reach us by calling Maryland Access Point, which is MAP. And that number is 410-396-2273. And I do encourage Baltimore City Medicare beneficiaries ages 65 and older, 64 and under with disabilities, low income, and people that are new to Medicare. I encourage them to please utilize our services because we are here for Baltimore City. Thank you.
Whoops. Thank you so much, Ms. Massey. I really appreciate you. I think what's important about your presentation and the presentation from Ms. Dorn is that what you've demonstrated is the partnership of state and local services that are available. And something really important to highlight here in this public forum, there are state and city resources available to all residents of Baltimore City. And there's a hand in glove kind of interaction between the Maryland Insurance Administration and the Senior Health Insurance Program, where the Maryland Insurance Administration, works to implement state policy, and SHIP is right there in the city doing the hands-on assistance, and that's really wonderful. So thank you. We'll make sure to share your information as broadly as we can, Ms. Massey.
Thank you.
Now we'll move on to some private resources that are available to people of Baltimore City who are facing this decision point about their Medicare Advantage plans. We are lucky to have Mr. Alex Wertentile from the, who's the agency manager for the Health Markets Insurance Agency, a private broker that helps people seek plans. So Mr. Wertentile, and I do hope I'm pronouncing your last name correctly.
Perfect. Good job.
Okay, great. I studied a little German, so we got you. But let me hand the mic to you. Thank you for being here.
Thank you, Delegate Lewis, and thank you to all the presenters that presented before me. I appreciate the opportunity to be here this evening and to present to you. I'm actually a Baltimore resident myself. Like Delegate Lewis mentioned, my name is Alex Wertentile. I am the agency manager with Health Markets Insurance Agency here in Maryland. I've been with the company for 20 years. And what we do at Health Markets, both on a national level and more importantly on a local level, is help individuals with all of their insurance needs and their financial well-being. The nice thing about what we do is that we are able to sit down, whether it's face-to-face, virtually, via Zoom, in whatever forum and whatever setting works for the individual, and help them with their insurance needs. Particularly in a situation like this, and as was referenced earlier with the annual open enrollment that just ended, we've spent the last period of time from October 15th until December 7th helping literally thousands of individuals in Maryland determine what is the best solution for them for 2022. And just to piggyback and echo some of the remarks that were made, you have a lot of options. You have an option to go with a different Medicare Advantage. You have an option to go with the Medicare Supplement. At Health Markets, myself and my team of agents can sit down with you and decide with you what is going to be the best solution. What is the best path forward based on your needs and your budget? And at Health Markets, we have absolutely no bias or allegiance to one company over another. So as was listed from the Maryland Insurance Administration just a few moments ago, there's a number of other options on the Medicare Advantage front. There's various prescription drug plans, and there's many Medicare supplement plans. And what we need to do is figure out what is the best solution for you. And myself and my team are more than happy to sit down with you and determine what's going to be the best solution. Just to be very clear, we get paid from the insurance companies. You don't pay us at all. So there's literally no cost to you. It's free advice of determining what's going to be the best solution for you. And I can tell you that we are extremely well experienced, particularly in Baltimore City with the Johns Hopkins plans. We've been working with the Johns Hopkins plan since they started a number of years ago. And myself and my team really work with Hopkins and many of the other Medicare Advantage plans. And again, I'm gonna repeat what I said and reiterate with absolutely no bias. So you could call 301-520-6097. Again, I'm sure it's going to be sent out, but 301-520-6097. And either myself personally or one of my agents would be happy to discuss with you your options. And again, there's no obligations, there's no requirements, nothing of that nature. It's more of a question of helping you, like we've done for so many Baltimore City constituents over the last months and frankly over the last number of years.
Terrific. Thank you so much, Mr. Wertentile. I appreciate you being here, and we'll make sure to share your contact information. I'll mention that we had hoped to have a second private insurance broker, Ms. Linda McCollum Hall from the Golden Outlook Company. I think she wasn't able to connect into the Zoom, but she's another resource, and we'll make her information available as well. And finally, I'll mention that in terms of finding private brokers to join us and share their resources this evening, we identified them through phone calls and emails and asking trusted state and local partners for contacts. So we're glad to be able to offer a broader menu of resources for you. So that marks the end of our presentations, and I thank everyone again. The last segment of the public forum is questions submitted by members of the public, by concerned Baltimore City residents. And what we'll do now is our very best to answer those questions. We've got great experts here on the line, and I will share the questions. I'll read the question, and then I'll ask the person I think best placed to answer, and you do your best. And we'll try to get that done. Amelia will help us keep time, and we'll try to get that done in the next 10 minutes. Okay. So I'll start first with the most common question, which was, please explain why Hopkins canceled plans in Baltimore City and Calvert County. Now, Ms. McCann did answer that question at the beginning, but if you could perhaps succinctly answer that one so we can get it out of the way. And I think you might be muted. There you go.
Sure. Thank you. Yes, as I noted in our opening remarks, there is a sort of payment distortion for Medicare Advantage here in Maryland. Many Medicare Advantage plans have struggled, and many Medicare Advantage plans have actually left the market here in Maryland, Baltimore City, and the state in total. Plans are required to have certain financial sustainability targets. And we, absent a fix to the challenges with Medicare Advantage in Maryland, we had to make difficult decisions about how to achieve stability and sustainability. And that is why we made the difficult decision to have a service area reduction in Baltimore City and Calvert County. And as I noted earlier, those jurisdictions, those areas were chosen because they were the highest cost areas.
Thank you. Thank you, Ms. McCann. The second most frequently asked question was, what changes need to be made to city, state, or federal laws in order to ensure that the people of Baltimore have access to Medicare Advantage? And I think, I'll try to answer that one as the policymaker in the room. And I do believe Congressman Sarbanes, Congressman Infume, and my colleague, State Senator Cory McCray, would join me in saying first that we are committed to making whatever policy changes are required to protect access to healthcare and healthcare insurance for all the people of Maryland. And it is certainly true, as Ms. McCann described, there are policy decisions that were set that make it a challenge to offer healthcare insurance in general, and particularly the Medicare Advantage insurance plans in Maryland and in our city. So the changes that are going to be required are policy changes. Those changes are in the hands of policy makers. So it's up to your state elected representatives in the Maryland House of Delegates and State Senate, and your federal representatives in the US House of Representatives and the US Senate to work together to fix the policies that made this situation happen. And I and my colleagues are committed to doing that, committed to fixing that. I'll also mention that President of the United States, President Joe Biden, has expressed a commitment to fixing Medicare. And part of his Build Back Better plan includes an increase in dental coverage for Medicare policyholders, plan holders. And I know he will do much more if he can. But that's the level of the problem. It's really in the hands of our federal partners and our state folks, representatives as well. And we're committed to fixing it. So know that. The next question, will I lose my Medicare coverage? That might be a good question for our MIA, Maryland Insurance Administration rep, Ms. Dorn. Will I lose my Medicare coverage?
So while you are losing the Medicare Advantage Plan, the Johns Hopkins Medicare Advantage Plan, you will not be losing Medicare Parts A and B.
And what is A and B again?
So Medicare Part A, that's going to be the hospitalization coverage. Medicare Part B, that is more like outpatient. So that's more like providers that you see in an outpatient setting, maybe ultrasounds, MRIs, things like that. That's what's covered. So A, hospitalization, B, outpatient, and together they cover about 80% of those costs.
Thank you. So that's basic Medicare. That's Parts A and B, it's basic Medicare.
Often called original Medicare.
Original Medicare. Thank you. So no one will lose that. Anyone who has a Medicare plan now, whether basic Medicare or Medicare Advantage, they will still have Medicare coverage. They will not lose that coverage. Okay, thank you. Thank you very much. However, they have the option of choosing a new Advantage plan or choosing a Medicare supplemental plan, along with, if they choose, a Medicare Part D private plan.
That's exactly right.
Okay, thank you so much. The next question we got was, how do I sign up for a new plan, a new Medicare Advantage plan? And how do I sign up? I think I'll direct that question to you, Ms. Massey, from the Senior Health Insurance Program.
What they want to do is call that MAP number that I gave, 410-396-2273, and ask for a SHIP counselor. And we do have a scheduler that will be scheduling additional appointments because again, we're going beyond December 7th. Appointment slots are limited, but we're going to do the best that we can to serve as many people as we can. The other alternative for folks is to call 1-800-MEDICARE, and they will also do enrollment. And we do encourage Hopkins members to try their best to choose something, because being left with just original Medicare means that's that 20% that Medicare does not cover, and they will be left with invoicing of bills. I know that it's difficult and for everybody, but we also screen to see if they would qualify for the QMB service or SLMB or SPDAP or LIS. So that's what we do also. But we do encourage them to choose something, try so they can avoid that 20% out of pocket for themselves.
Massey, could you explain what those acronyms you used? Because I don't recognize any of them.
I'm sorry. I'm sorry. QMB is Qualified Medicare Beneficiary Program. So with the QMB program, they pay basically, if you qualify and eligible for that program, basically that 20% is covered that Medicare does not pay. Okay, so that's a great incentive for a person that would qualify for that program. Then for ones that does not qualify for the QMB, the Slim B is specified low income program, which the premium would be paid, the Part B premium would be paid. So that would at least give the beneficiary something back in their pocket, okay? With the SPDAP, that's the Senior Prescription Assistance Program, they will cover they will pay $50 towards the premium for the Part D plan for the person if they qualify for that program. And LIS Extra Help is a Social Security program that helps also with Part D if they qualify for if they qualify for that program. So there's two parts to the LIS. One is a full coverage where the person is going to get the full benefits, paying for the premium and a certain percentage of the very low cost for their drugs. Then there's the partial LIS program. This is all through Social Security, and of course, naturally, they will get a little higher, but they're also receiving the discounts and the cost of the premium being paid for them.
Thank you so much. I just learned. I wish I had known all that when my mom was, near the end of her life, and we weren't really well educated about Medicare. So,
Delegate
but
Lewis,
yes, please.
Yeah, sorry to interrupt. I just wanted to reinforce what Ms. Massey had said, because we do know that some of the Hopkins Advantage members do meet those eligibility criteria. So this is additional assistance that people are eligible for. So, do strongly encourage people to reach out and explore whether or not they are eligible, because we certainly know that some of the members are.
Right.
Really good to be reminded. I think the other important thing about what you said, Ms. Massey, what became very obvious is that Medicare is complicated and people are going to need help. I work in health policy and I needed help to understand this. So I think it's really wonderful to know that the SHIP program is there, ready to take calls and walk people through and assist them. That's really important. I think also when it comes to answering the question, how do I sign up for a new plan? Mr. Wertentile is also a resource. So Mr. Wertentile, do you help people figure out LIS and QMB?
Yeah, I was familiar with everything Ms. Massey said, and it's very complicated, and particularly when you're lower income, it's even more complicated to figure out what percentage of the premiums are covered, your co-pays on prescriptions and doctors. And absolutely, myself and my team are well equipped, and we're certified and educated on all of these aspects of this very complicated arena. So absolutely, we certainly can meet with individuals and talk to them about all of these details. Sure.
Thank you. Sorry to speak over you there. Thank you so much. Lots of resources for people to help with really complicated stuff. Can I just say, I'm just really feeling like we need universal health care. We need a single payer. Can I just say that? This is my Zoom. Okay. This is all really complicated, but I'm glad you guys are all here. And we have time for one more question, Amelia. Is that what you're telling me? Okay, I'm getting a signal. Okay, here's a question. I hope you guys can help me answer. How can I ensure my current doctors, medications, and health services that I had on my old Medicare Advantage plan will be covered and available in a new plan? Who's the best person to answer that? Would that be Ms. Dorn, Ms. Massey?
I would love to answer that.
Go for it.
What SHIP encourages everybody to do is to inquire directly with your doctors. What plans do they cover in their office? Oftentimes, people don't think to do that, but if you find out what they offer, then that would be a much easier and less stressful way for you to make your decisions. Yes, it's going to mean that you're going to ask each doctor, and then hopefully if all of them share the same plan, that makes it even greater for you. But if not, yes, you're going to have to do some juggling, making some decisions. But I would say the first step we encourage them to do is talk to their
Mr.
first.
Sorry, go ahead. Sorry.
That's okay.
Ms. Massey, please go ahead. Don't mind me.
Oh, okay. So I'm just saying the first step that we encourage the beneficiaries to do is talk to their doctors and see what they offer, what plans do they offer, advantage plans, supplement plans. That's what we encourage them to do first. And then they can call us back. They can go directly to the plan and enroll. And like I said, we do that purposely to alleviate stress, because when you're trying to think because you do have some people that will apply for something, enroll in something, and then they find out their doctors don't carry that plan. So people won't be stuck for the entire year like that, making all these different changes. That's the first step that we ask that they take.
That's fantastic advice. Thank you so much.
You're
That
welcome.
winds up the questions that we received in writing from the public. Chances are there are folks out there watching the Zoom right now who have original questions that we didn't cover. If you are one of our listeners out there with questions we didn't cover, I urge you to contact my office by email, you can private message me, and we will do our very best working with our expert panelists and other resources to get your questions answered and make the answers available publicly. I think I'm getting the signal to wind up. We'll go to the last slide in this evening's public forum. You'll see in front of you the Hopkins dedicated toll-free hotline. This is a dedicated line offered by the Hopkins Advantage MD plans for those plan holders to get more information. In addition, the Maryland State, and I'll just read the number, just make sure people can know what the Hopkins dedicated toll-free hotline is 844-820-1227. The Maryland State Health Insurance Program, or SHIP, has free and confidential counselors available at 800-735-2258. And of course, Medicare has call assistance 24/7 available. All you have to do is dial 1-800-Medicare. That's 1-800-633-4227. In addition, our wonderful state agency, the Maryland Insurance Administration, or MIA, offers training and information workshops. Go to their website, sign up for their email list, get updates about workshops. I signed up. I have seen the light, and I will be sure to learn as much as I can from the great services they offer. Go to, on your computer, on the internet, https://insurance.maryland.gov/. If you have problems with any coverage, whether it's health insurance, Medicare, Medicaid, whether it's auto insurance, homeowners insurance, you can contact the Maryland Insurance Administration. This is their wheelhouse. If you're not satisfied, you're having trouble, you can file a complaint with the MIA. Email them at lhcomplaints.mia@maryland.gov or call 410-468-2244. With that, I thank my panelists who made time late on a Thursday night to be present and answer questions to help the people of Baltimore City get the health care they need and deserve. Thank you to those members of the public who submitted questions. I hope we answered them. Thanks to my staff, my hardworking and much aggrieved staff for all of their help. We will post this Zoom video publicly and hope that you'll stay in touch. With that, we'll sign off. Good night. All right, panelists, you guys are my heroes. Go sit down and have some dinner, put your feet up. You'll also get all of the follow-up materials, and I will be reaching out to you again because I know I'm going to need your help. Okay, thank you all.
Thank you.
Good night.
Thank you. Good night.
Good night.
Thank you so much. Have a good night.
Thank you.